Hi, this is Tim from ChiroUp, and I'd like to talk today about one of the more common presentations that we see, and that's greater trochanteric pain syndrome. Used to call it hip bursitis, but now we know that it's more. It usually involves weakness of the hip abductor muscles. That's really the crux of the problem, especially the gluteus medius. The gluteus medius, remember, comes off of the iliac crest and runs down to attach on the greater trochanter. And its job is to help maintain frontal plane alignment of the thigh when we squat. When that muscle is weak, we can detect it. So we have the patient do a squat test. And what we're looking for is there a pelvic unleveling? Does the opposite side drop down? And when they squat, do the knees come together? There's uncontrolled adduction, or maybe the feet go into hyperpronation, or just a general instability of the area. Any of those things are signs that the hip abductor is weak, and it's not likely we'll solve the trochanteric bursitis or greater trochanteric pain syndrome until we solve that. But sometimes the problem is bigger than just weakness. Sometimes there's a tear. And I want to show you a useful test called the hip lag sign that can help us identify that. This is a simple test, only takes a couple of seconds. We're going to have the patient lie on their side with the affected side up. Then we're going to move their thigh, and we're going to do that for them. Take their thigh into abduction about 20 degrees, extension 10 degrees, and then maximum internal rotation. And so I'm holding the thigh, and then I'm going to ask the patient to take over. And when I let go, we'd like to see things stay in a stable position. If the hip rotates, the thigh rotates, and the hip drops down more than 10 centimeters, or the patient is unable to hold that position, that's a positive test. It has excellent sensitivity and specificity. It has a sensitivity of 90%, so that if that problem's there, it's likely to show up. And it has a specificity of 97%, meaning that if this test is positive, there's quite likely a tear of the gluteus medius, most often right at the greater trochanter. And these problems are incredibly common. They've been given the moniker rotator cuff tears of the hip because of how common they are. I hope that this test is helpful. I hope you can apply it to practice, and we're grateful to be your partner in delivering clinical excellence. Thanks for watching.